Okay, so we're getting to a really big table now. It's a big table. It's going to be maybe a bit chaotic or not so clear. Anyways, we're getting to patterns, and this is so crucial for you. So it's going to be a really huge table where I will try to sum up everything. So I'm going to try to show you patterns or principles in let's say, acute lymphoblastic leukemias, acute myeloid leukemias, myelodysplastic syndrome, myeloproliferative neoplasms, and of course lymphomas. And the main pattern or the thing where I was aiming all the time is actually the thing you should understand is if there is a mutation within the hematopoietic stem cell or it's, let's say, some kind of progenitors, okay, so a bit later in the tree, because if we talk about a tree in this case, I mean that let's say the main branch or the first branch, that's the hematopoietic stem cells, and then it branches out. So if it's somewhere farther in the branch, like the progenitor B cells or T cells or let's say granulocyte macrophage progenitor, remember these mutations are within really unmaturated cell. So that's why also it really happens early. There's a clonal expansion and the mutation is in many, many cells. That's why it's a big difference compared to mutations that happen in lymphomas. Lymphomas are neoplasms of cells that are matured. So if we talk about therapy, typically remember in terms of AML, ALL, MDS, MPN, myeloproliferative neoplasms, you rather, or in general, you cannot use autologous hematopoietic stem cell transplantation. Or you use it in some cases, but very specialist, and those are special circumstances, rarely, because basically the mutation is in all the cells. So typically you would take and give back already a neoplastic cell, so you have to clear them out and it's really hard. But of course, if the allogenic hematopoietic stem cell transplantation fails, then you could maybe try to use the autologous with you have to pick up the cells with a flow cytometry and with a sorter that takes only the special cells you want. In contrast, for lymphomas, the autologous hematopoietic stem cell transplantation is used very commonly. Okay, so that's the main thing you should understand. So if the mutation happens early in the tree before the cells are developed, hematologic cells are developed, you have to try allogenic hematopoietic stem cell transplantation. That means from someone else. If it's lymphomas like Hodgkin, whatever, very commonly, and typically, of course, it's much safer, you take their own blood, you take the stem cells out, which should be okay because the mutation happened in lymphocytes that were already matured. So the stem cells should be okay. And these you give back to the patient after you irradiate him and you use chemotherapy. So after you kill all the cells in the body, you return the autologous hematopoietic stem cells. So that's the main principle where we're aiming. And we're going to end with this, but it's a big table. And because it's a big table, I'm going to rather go like vertically. So we're going to have a disease. We're going to start with AML and we're going to go downwards. So we're going to talk about mutations. And at the end, we end with transplantation you can use. Okay. So the first, what I'm going to do over here, I'm going to draw the different organs or different tissues or whatever. So first, so this is bone marrow. Okay, then I'm going to draw thymus. So as we are used to it, so this should resemble thymus. Then I'm going to draw a lymph node like this. Let's put it here. Let's put the follicles here. Then I'm gonna put it in green. Let's make it big because this is a spleen. Okay. I'm gonna put S here that you understand it's spleen, and I'm gonna still put skin here. That's especially for the T lymphocytes and T lymphomas. Okay. So, and what we're gonna put here we're gonna put the diseases. So let's put the diseases. And first it's going to be acute myeloid leukemia. Then there's going to be myelodysplastic syndrome. Then we're going to put myeloproliferative neoplasm. Then we're going to put acute lymphoblastic leukemia. That's B and T, B/T. Then we're going to put B-cell lymphoma. And a T-cell lymphoma. Okay. And in what organ typically this originates? So in bone marrow, AML, of course, myelodysplastic syndrome, myeloproliferative neoplasms, as well as acute lymphoblastic leukemia. But over here we can put thymus as well for the T lymphocytes. And then how is it with lymphomas? Well, you put the lymph node here. You can put the spleen here, of course. And you can put the T cell. And still you can put the lymph node, the T cell as well. Okay? So it's like this. So these are related. Okay, these typically, most commonly. Okay, and let's put the category, what will be vertically. So first of all, what's interesting for us and very important is cell of origin. So let's put cell of origin. There are going to be many. I'll try to keep it in the line, we'll see. Then there is a developmental stage when it happens. Stage. Then put a primary physiological process affected. So which physiological process is affected? That's important. So primary physiological process affected. Then there's going to be timing of oncogenic events. So timing of oncogenic events. So when it happens, most commonly. Then there's going to be mechanisms of transformation. So mechanisms of transformation. And we're going to have common driver mutations or translocations. Then if there is a role of the virus, so role of viral infection, then a common age group. That's important for you to realize this. So common age group, then a primary site of disease, then examples of immunophenotype, then if there is a role of somatic hypermutation, then if there is a relation to VDJ recombination, so VDJ recombination error or errors, then what is the clinical behavior of the disease? Behavior. And now, how is it with the hematopoietic stem cell transplantation or bone marrow transplantation? So, main two types, allogenic or autologous. So, and let's get to the specific diseases, and we're going to go vertically again. So, if I go up over here, cell of origin, that's crucial. So in case of AML, we imagine that those are myeloid progenitors typically. So it could be a granulocyte macrophage progenitor, or let's say common myeloid progenitor or myeloblast. So they're a bit farther in the tree rather later than that the mutation would happen within the hematopoietic stem cell. That would be the highest. They're a bit later. It's within progenitor. So over here, put myeloid progenitor. And yeah, you can put the granulocyte macrophage progenitor, so GMP, or it happens within CMP, that's the common myeloid progenitor, or myeloblast. Well, what this tells you, it tells you it happens farther. So it's within the myeloid lineage. So as we talked before that, for example, myelodysplastic syndrome and myeloproliferative neoplasms, we're going to talk about them later after we finish this one, they can transform into ALL as well, for example, because it's high in the stem cell. But in case of AML, already it's within the myeloid progenitor. So rather, and it's very unlikely that this would transform into lymphoid lineage, okay, in an acute lymphoblastic leukemia. So rather, it will stay within myeloid lineage, okay, only because the mutation happened already when the cells go this way through the myeloid lineage, okay? Yeah, get it? So typically we find mutations later, and the clonal expansion happens within already a defined myeloid lineage. That's why transformation into a lymphoid lineage is rather unlikely, and you don't see it. So what's the development stage? It's the early myelopoiesis, okay? So early, so at the beginning, but not so high, okay? So early myelopoiesis. So that's AML. And how is it with the primary physiological process affected? Well, it's the differentiation, proliferation, and epigenetic regulation. So differentiation, proliferation, and epigenetic regulation. Okay, that's AML. And still, what is the timing? So when it happens, when the mutation happens, and this is typically postnatal within the hematopoietic progenitor. So postnatally, it happens postnatally and in the hematopoietic progenitors. Okay. What is the mechanism of transformation? Well, then there is the differentiation block plus there's uncontrolled proliferation. So as we talked about class 1 and class 2 mutation. So driver mutation and loss of function mutation. So uncontrolled proliferation. We talked about the driver mutation. Some of them I can mention again and remind you. It could be FLT3, so ITD, just some examples, okay? NPM1, and for example, RUNX1T1, okay? Is there a role of a virus in this case? Rarely, but it could be so rare compared to lymphomas, for example. But a CMV sometimes is suspected in immunocompromised, especially. Okay. What is the common age group? Typically in adults. Adults and elderly, so median is over 60 years. Okay, so adults and elderly, and the median is over 60 years. Primary site of disease, that's the bone marrow, okay? Okay, so bone marrow. And of course, when they get out, it's in the peripheral blood. And you see many blasts over there. Immunophenotype, yeah, well, of course, they can still have CD34s on them. CD117, for example, CD13, I don't want to go over it. They're going to be MPO positive because those are, of course, myeloblasts. Somatic hypermutation, is it related to this? No, so it's not present because this would be within the lymphoid tissue and lymphoid lineage. VDJ recombination, it's rarely relevant. There are a few exceptions. You should think of indirect rather influence and mixed versions of AML, whatever. How it behaves? It's aggressive. Often aggressive and very rapid onset. So aggressive, typically aggressive, and rapid onset. And what about the transplantation? It's allogenic, of course. So as I mentioned at the beginning, so it's allogenic hematopoietic stem cell transplantation. It's commonly used in high risk or relapse AML. Autologous transplantation, as I said, very rarely, just in selected cases. So when there's no way out, yeah, sometimes they can try. So that was AML.
So, thanks for watching, and don't forget to subscribe and ring that bell. And as always, check the description below for supplementary questions and other materials.